Human immunodeficiency virus, presented by Asia Turner, Medical Terminology, Spring 2020. Origination: Human immunodeficiency virus originated in chimps and primates of African jungles. It is believed that the chimpanzee version of HIV was simian immunodeficiency virus, or SIV. The virus was most likely transmitted to humans and mutated to HIV when they hunted these chimpanzees for meat and encountered their infected blood. How HIV affects the body. HIV is an uncurable virus that attacks the immune system, specifically the CD4 cells in the body, also known as T helper cells. This virus can destroy the immune system, making it hard to fight off infections and diseases. If left untreated, the virus will eventually turn into acquired immunodeficiency syndrome, or AIDS. A weakened immune system makes an individual more susceptible to infections and disease. The difference between HIV and AIDS. HIV. HIV is a virus. You can have HIV without having AIDS. An individual can live decades with HIV. HIV has no cure but is treatable. AIDS. AIDS is a disease. Someone with AIDS must have the HIV virus. Once the virus turns into AIDS, the individual's life expectancy drops drastically. AIDS is the final stage of HIV. The stages of HIV. Stage 1. Acute HIV infection. An individual will experience flu-like symptoms that may only last a few days to a few weeks. Many people with the acute infection are often unaware that they have the virus. The infected person has a large amount of virus in their body and is highly contagious. Stage 2. Clinical latency. This phase can last decades if treated properly, but some people may progress faster than others. The virus is still active but may replicate at low levels. It is important to know that the virus is still transmittable in this phase even though it is replicating slowly. Stage 3. AIDS. At this stage, the immune system is damaged to the point that the infected individual has an increasing risk of getting severe illnesses called opportunistic illness. Without treatment, people with AIDS typically live no longer than 3 years. People with AIDS are highly contagious and have a high viral load. How HIV affects the world. According to AIDS.gov, 36.7 million people worldwide are living with HIV, and 35 million people have died since 1981. Of the people among us that have HIV, 1 in 7 people don't know that they are infected. All people are not at equal risk, though. Gay and bisexual individuals of all races and ethnicities remain at the most risk for being infected. The virus is most prominent but not limited to urban areas. The Northeast has the highest rate of people living with the infection. Experiencing different sexual activities can put you at a higher risk for being exposed to HIV. Some of the main reasons the virus is spread: men who have sex with other men, having multiple partners, drug use through injection, transgender people who have sex with other men. Receiving anal sex carries the most risk for getting HIV over any other sexual activity. Anyone who practices sex without a condom or shares needles can contract HIV. How HIV spreads. HIV is found in blood, semen, preseminal fluid, vaginal fluid, rectal fluid, and breast milk. HIV spreads when one of these fluids from a person who has HIV enters the body of a person who does not. In rare cases, HIV can be transmitted by oral sex only if an HIV-positive man ejaculates in his partner's mouth. Common acts that do not spread HIV. HIV is not spread by mosquitoes, ticks, other insects, saliva, tears, sweat that is not mixed with the blood of an HIV-positive person, hugging, shaking hands, sharing toilets, sharing dishes, or other sexual activities that don't involve the exchange of bodily fluids. Treatment. Starting and staying on treatment helps stop the damage that HIV causes to the immune system. One goal for treatment is to be undetectable, making it so that there is less virus in your body. The treatment plan for HIV, which is a retroviral virus, involves taking a combination of medicines that are referred to as antiretroviral therapy. This treatment can keep an individual with HIV healthy for many years and reduce the viral load in the blood and body fluids. Usually a combination of 3 or more drugs has the best chance of lowering the amount of HIV in the body. Regardless of how long you've had HIV or how healthy you may be, treatment is always recommended. The U.S. Department of Health recommends that an individual with HIV begin antiretroviral therapy as soon as possible after being diagnosed. Side effects of treatment. Side effects of treatment may vary depending on the person. Not everyone will experience these side effects. Some common side effects of antiretroviral therapy that an individual may experience when receiving treatment can include nausea, vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain. If an individual is having problems or experiences sickness, it is recommended that they see their healthcare provider or pharmacist immediately so that they can adjust or change the medication, or even provide medicine to help deal with the side effects. Prevention. Taking HIV medicine every day helps the virus get to and stay undetectable. According to the latest scientific research, being undetectable means there is almost no risk in spreading HIV through sex, because there is virtually no virus present. There are also medications for healthy people who don't have HIV called Truvada and pre-exposure prophylaxis, or PrEP. PrEP and Truvada is for people at risk for HIV that want to take daily medicine to prevent the virus from transmitting to them. When taken properly, both pills can reduce the risk of transmission of HIV by over 90%. Getting tested and retested every 3 to 6 months can help as well, because you will be able to narrow the window of when you got the virus and you can act immediately. Don't let this virus control your life or end it. Control the virus with education, prevention, and treatment.